Well, we bring you our health and wellness slot, and this week we focus on one of the most dreaded diseases in the world, cancer, C-A-N-C-E-R. The world marked International Cancer Day on the 4th of February. Now, cancer is one of the leading killers in the world, claiming over 8.2 million lives globally. It is also one of the difficult diseases to manage because it manifests itself in different ways that are difficult to detect in various parts of the body. But latest medical technologies and therapies have alleviated the suffering experienced by patients and loved ones. But like most things in life, more informed knowledge about cancer will empower us to manage it better. The world's cancer theme this year is We Can, I Can. To tell us more about the theme and educate us more about cancer is Professor Michael Herbst, who is health specialist from Cancer Association of South Africa. Professor, pleasure to have you with us.
Wonderful to be here. Thank you for the invitation.
And we appreciate that you are here to help us appreciate the challenge that we face, and sometimes we are confused because it's a
very complex
disease this. Now, the theme first, explain it to me, what does it mean, this We Can, I Can?
It's a wonderful theme that was decided, and it's the international theme. And what we mean by We Can, I Can is things that we as a collective group can do, or I as an individual can do, to reduce my risk for getting cancer. It is so important.
Now, you have a theme for the group and, of course, for the individuals. Firstly, how does it manifest? Let me, as I mentioned, an 8.2 million figure there, right, that people succumb to cancer every year. In South Africa, what are the numbers?
Well, we have at the moment, unfortunately, still working on the 2010 statistics.
Yes.
We're hoping that something will happen with the registry, that we will get more recent stats soon. But between 50 and 60,000 people every year hear the words said by their doctor to them, you have cancer. One of the more than 200 cancers.
Right.
It's as you were saying, it's complex. Over 200 different cancers.
But you know, when you talk cancer, we don't mean the same thing, right? It's different. One cancer is different from the other.
Absolutely different from the other.
And the most prevalent would be?
Well, if we look at women, it will be breast cancer, cervical cancer. And then if you start looking at different population groups, they may switch around.
Right.
That cervical may be one and breast cancer will be the other. Amongst men, the two of the top cancers will be prostate cancer. It is more than 20% of all cancers diagnosed in men will be prostate cancer.
Right.
And the scary thing amongst men is that we're seeing many men now being diagnosed under the age of 40 already. And that's very scary to see that happening, because it was always a disease of older men.
So it's an age-related disease, especially in the case of men.
It is still age-related. The incidence is still higher in the more mature groups.
Yes.
But we're seeing many men now being diagnosed under the age of 40.
Sure.
And then also lung cancer is a very important thing. And that will come when we talk about our themes. What we and what I can do, we'll talk a little bit more about that. Then cancer of unknown origin is something that is coming very prevalent amongst men and women. Cancer is diagnosed, but the doctors cannot always find out where the cancer originated in the body.
But now, the diagnosis of cancer, how is it diagnosed, and what is the onset? What leads to the onset of cancer in the first place?
Well, there are so many things. We know that many of the cancers are age-related. As we get older, we are continually exposed to chemicals, to the sun, to things that we put on our bodies, things that we put inside our bodies, and all these can affect, including things in the environment. And they can all change the DNA within the cells of the body. And once the DNA in the body cells have been changed, the cells start multiplying without control, and we get cancer, and it eventually develops a tumor.
Is it avoidable, cancer, though?
I won't say it's avoidable, but we can reduce the risk.
Yes.
So what can I do as an individual? First and foremost, do not smoke. If you smoke, please get help to get rid of the habit of smoking.
So it's not like smoke less or anything like
No,
that?
stop smoking.
So-
do you know that tobacco is the only product legally sold in South Africa that kills more than half of its users if they use the product correctly? That is, if that doesn't hit hard,
Yes.
nothing else will hit hard.
Yeah.
Tobacco is evil. The next one, really try and reduce the intake of alcohol and avoid it if at all possible.
Yes.
And I think our Minister of Health is soon on his way to do something
I
about alcohol.
can understand with smoking that it leads to lung cancer and
Yes.
probably other related cancers, right, in the upper body. And as far as alcohol, for instance,
Well,
abuse?
alcohol is specifically linked to what we refer to as the hormonal cancers.
Okay.
The breast cancer, the cervical cancer, the prostate cancer, testicular cancer. That type of cancer
Yes.
where hormones of the body can and is also involved.
Okay.
So that is important to
Sure.
remember there. Alcohol, not a good thing at all. Try and reduce the intake of red meat.
Red meat?
Red meat has been classified now by the World Health Organization as a group 1. There is sufficient evidence that it can cause cancer in humans.
Sure.
So red meat should be reduced, and then processed foods should be avoided if at all possible, because they put in various type of preservatives, and here I'm thinking specifically of the nitrates and the nitrites as preservatives, especially in many of the polonies and the sausages and things like that, and that should be a no-no for us.
So those are some of the lifestyle changes you can make,
But
right?
we and I can do.
Sure. Now, most of I've heard people, after going to for consultations with doctors, saying they're told that the cancer was detected very late, and it had spread to other parts of the body. If it had been detected much earlier, they would have been helped. So, what is it that you can do to at least make sure that if you develop cancer, then it can be detected early? What are the things to look out for?
Exactly what we're doing now, to provide information to the general public out there. And the major message is, know your body.
Right.
If you don't know your body, you won't know if something is different today from what it was yesterday or last week or last month. But if you know your body, the moment you recognize that something is changing, go and seek advice. And here we teach women how to do breast self-exam. So if she picks up every month doing a breast self-examination, she will find. We teach people how to examine their skins, because we live in a very sunny country, and it's not only white people who get skin cancer. People with darker skin tones also get it. A good example is the wonderful musician that we lost, Bob Marley. He got one of the worst forms of skin cancer called melanoma. And this is the funny thing about melanoma, especially in people with darker skin tones. They get the skin cancer melanoma in parts of their body that's not exposed to the sun. Bob Marley, for instance, got it under a toenail. It was neglected, and we lost this wonderful musician because of skin cancer.
The stigma attached to cancer. Tell me more about it. I mean,
Yes, that is really a problem. Well, not only with people of darker skin tones. In the white communities, I can remember as a young person, if you told somebody else that so-and-so had cancer, you'd say, oh, they had cancer. And you put your hand in front of you, or that so-and-so's got the big C. They didn't even want to mention the word. And it is really problematic. If we can break down the barriers and let people talk about it, more people will come out earlier. And we still have an access problem in South Africa. That access to healthcare is a problem.
but Prof, I suppose the stigma comes about as a result of cancer being generally regarded as a death sentence.
That contributes to it. You are so correct.
And that is exactly that thing that would keep people away from going for medical consultations, because they dread being told.
They don't want to hear.
Exactly.
And if
So-
I don't hear, I can hide my head under the sand
Yes.
and it doesn't exist.
But briefly tell me, is cancer a death sentence in the event you are diagnosed with cancer?
No, not necessarily. And that is why you've got to know your body to have early diagnosis so that early treatment can be instituted. And then most cancers become treatable conditions
And the pain and the suffering gets alleviated as a result.
as a result. And we must just remember that not all cancer patients suffer terrible pain.
Yes.
Stats and research shows us that only 1 in 3 cancer patients will experience pain.
Well, Prof, we will deal with the specific cancers and different types of cancer, but just wanted us to have a broad overview of what we are talking about when we talk about cancers, and the fact that I can deal with this big challenge. It's not only in South Africa that we've got to contend with cancer. Around the globe, it is an international problem. But then one of those problems that can be dealt with, and of course modern science, medical science, also coming up with new technologies and therapies to help alleviate the pain and in some instances obliterate cancer. Much appreciated, Prof.
Thank you very, very
much
much.
for talking to us.
Thank you.
And of course, Professor Michael Herbst will be back with us in the future to deal with some of the cancers that we spoke about.